did it feel? Can't say it didn't surprise me. Last time I looked to my right, you was standing beside me. How can some people I love hang around who try me? Let's go. What did I miss? What did I miss? What did I miss? What did I miss? Let's go. Let's go. I'm whipping around on like 600 acres. Let's go. Let's go. Let's go. You just better not ask for no favor. Let's go. Let's go. Let's go. It's love for my brothers and debt to a traitor. Let's go. She might decide to say no to me now, but say yes to me later. Let's go. Her is all natty like Florida Gator. Let's go.
Okay, it's definitely Mercury retrograde. Let's go. Let's go. Let's go. Let's go. And we are welcoming in by phone instead of in the studio our renowned physician and public health advocate. He's the director and chief vaccinologist of the CDU-KEDREN Mobile Street Medicine Program. That's a historically black institution, federally qualified health center. He also holds a joint faculty appointment in departments of family and community medicine and psychiatry at the Charles R. Drew University of Medicine and Science, which is, whether you know it or not, the fourth historically black medical school in the nation in South LA. He's also the physician member of the Air Quality Management Hearing Board. He's got a medical degree from University of Texas School of Medicine, residency at USC Keck, Masters of Public Health from Emory. If I read the whole bio, it's going to take the whole hour. Dr. Jerry Abram, welcome.
Thank you. I'm excited to be here.
Yeah, I think you're probably you're qualified to talk about so many different things, Dr. Abram. But interesting when this expertise in vaccinology and also the psychiatric piece, because it seems like there's definitely an overlap in this COVID era.
Absolutely. We have still so much work to do. It's what I said during the pandemic, and whether, for better or worse, still saying it today in 2025. So.
Yeah, so let's start there. I mean, you advocate for so many things, right? Equity in medicine, for underserved people, under-resourced people, LGBTQ plus people, American, Indian, Native, Alaskan, Black, Latino, Asian, Pacific Islanders, people experiencing houselessness, people with HIV. These are all things that you've actually worked on, right? People with severe mental illness. So all of these things are in your portfolio, but right now we're talking about this moment in time where we're coming out of COVID. I feel like we're still in that era in a way. And now people have really fallen off, at least my audience has, in terms of tracking vaccines, boosters, updates. We're hearing about new guidance from the government saying that certain people don't need to get COVID shots anymore. Where are we from your perspective as far as COVID vaccination and boosters and that whole process?
Yeah, absolutely, Dominique. I'll just start by saying we're in a very difficult spot, rock in a hard place. And I appreciate what you said about your listeners. I feel like for many of us, COVID-19 is far, far in our rear view mirrors, and some may have already forgotten it. And I do fear many have already forgotten the lessons that we should have learned. We should have known better before the pandemic. We definitely learned a lot and put a magnifying glass on the inequities, the injustices in our community, especially in South LA. And I feel like here we are. It almost feels like, did we literally just go back to where we started from? If not, turn the dial back even further. Sometimes I wonder if it's pre-Civil Rights Act era, and that's how it feels. And so specifically when it gets to vaccines and vaccine equity, absolutely concerned that the attacks on the CDC's Advisory Committee on Immunization Practices, watching how vaccines will move through our Food and Drug Administration, seeing how our Secretary is surrounding himself and have said very troubling statements about the efficacy, effectiveness, importance of vaccines in our lives and in society. This is very harmful, especially for a community that has already been harmed so much. There was already so much distrust and mistrust before COVID, during COVID, and now. And with this type of misinformation and disinformation, what is going to convince grandma and her grandbabies to roll up their sleeves and get their shots? And now even the doctors and the health professionals are confused. Where do we turn to for the best evidence and guidance and recommendations? So, yeah, I'm feeling like I'm aimlessly wandering in the desert for the moment.
But if I was under your advice, you would say what?
Oh, well, of course, the right answer is that we know vaccines save lives. There is a reason we do not see measles, mumps, rubella, why we do not have polio around us. These things are making a comeback in this day and age, and that is because we are not protecting ourselves and each other and society. That's what vaccines do, and that's why it's critical that those that are immunocompromised, immunosuppressed, especially those that are older, those that are taking immunosuppressive therapies, chemotherapy, for example, those that have very serious chronic conditions, a transplant patient, someone with organ failure. These folks need to be absolutely fully vaccinated for COVID-19. Stay up to date on your pneumonia vaccines. Every flu season, you should be getting your flu shots. And also, I would say on the other end of the spectrum, our very youngest, most vulnerable members of society, our babies, our kiddos, they need to make sure that we're adhering to the recommendations, the vaccine schedules that the CDC, was rolling out previously, that our pediatricians advocate for. We know that vaccines not only save lives, but they really do help, especially for our kiddos, stay in school, go to school, live their best life, healthiest life, longest life, most accomplished life. And so I can't understate, and you hear it from everything I'm saying, how important vaccines are to our healthcare infrastructure and to our lives. And that does feel like it's under attack right now.
Yeah, well, I mean, it is literally under attack because the folks that we turn to, like the CDC, and other agencies that advise the public and advise the lawmakers, are being defunded or given different guidance, or they're in transition. So, what happens on the local level? Like if if I'm a county or I'm a state, or I'm a household, and I'm not getting that guidance that I was getting before, where do I turn? How do I know what is the right advice at that point? Between that and the fact that there's this sea of random misinformation and information mixed together on social media, it seems like kind of a perfect storm for confusion.
Yeah, I'm going to give you a little bit of a curveball here, Dominique. The last time I was there at KBLA, I was on a panel with Tavis Smiley, and we were talking about the Nuri Martinez tapes from the LA City Council.
Wow.
And we were really diving deep into the tensions that were existing between the Black and Latino community here in LA. And I feel like this is really going to it plays into some of these narratives, and already Black and brown communities are afraid. And who can we trust? And now when you can't trust our federal government, including our CDC, that affects people's decisions, what they do in their kitchens, on their dining tables, what they decide to do for themselves, their bodies, their families, their communities. And I brought up the last conversation I had there KBLA, with Tavis Smiley specifically, because that was a rallying point. That was a tipping point in many ways where we would need to kind of figure out how do we move forward as a community. And I feel like that's where we are right now again. And the world is trying to divide us. But I'm feeling that means we're going to have to look to our city, our county, and our state to really step in where we really wanted assurance and confidence. where we want them to feel safe and that the recommendations, the medicines I'm putting into my body actually work and make us better. If I can't look to the federal government for those assurances, then I really do need to turn to our city and our county health officials and to our state for that guidance and confidence. And so for better or worse, we really do need to come together right now more than ever, especially on the local level, and not just about vaccines, but in all sorts of ways. How are we helping and looking after each other, including people that may look different than us, including people that we may have disagreements with, including people from different segments of our very own community, like we see right here in South Central, in South LA, where we really are trying to figure out how to weave this fabric of society together, including meeting the needs of both Black families and Latino families right here around Kedren and Charles Drew.
Yeah, and I remember during 2020, it was amazing to me to see all these people from other communities rushing to Kedren to try to get vaccines. It looked like people who had never been in South LA before were in these lines. It was very bizarre, but it shows you how, even though people may not acknowledge it all the time, people do realize the work that you guys are doing and how efficient, you guys are at Kedren.
Well, I didn't think you were going to take us back there, but since you did, those were horrific times. They were unprecedented, right? Yeah. It really felt biblical. I talked about during those days how it reminded me of the parable of the loaves and fishes. Like, would we ever have enough to feed the multitude? It reminded us of the story of Noah, really like, get on board, we're going to have to close the door, and, these floods are coming. And then I think of Moses, and really having to lead their people out of bondage, and into freedom. And that's what these, vaccines did for us during those days when there really was carnage. And I can't imagine, there are people who today really doubt whether all that happened. But as a physician and as someone who works in our hospitals and clinics, people died, and that was a very serious situation. Yeah. And it was a miracle turning point when those vaccines landed. And yeah, I was shocked by all the, how do I say it? I call it the WWW. The wealthy side, the white side, the west side found their way to a part of town that I've never seen them in before. We have been there since 1965, since the Watts riots, right?
That's amazing.
22 Black psychiatrists came together to form that acute psychiatric hospital so that Black and brown people had somewhere to go in the middle of those Watts riots. It's also how and why Charles Drew University was started during that time as well. We've been here for 60 years. It took a pandemic and for your life to be in jeopardy to come and see what was happening in our hood. And that was disturbing, but we did not just open the door and say, come on in. And we were very adamant that we needed to engage the community members too, because that was an opportunity for us to lose trust if they saw people not from our community getting in and stealing their shots, right? And so instead we said, oh, you want to learn? Then come learn. Help us find the arms, find the people that are hard to reach, hardly reach, for all the reasons you can imagine, in addition to distrust, mistrust. But I ain't got child care, transportation, elder care, no paid time off. How am I going to get there? I'm scared. Help us find those folks. You come and volunteered with Kedren for 8 weeks. I would happily give you a vaccine, and that's what we did. But we did not just say, get in line and get your shot. And those were controversial decisions that we had to make. But we fought, and I will say I personally fought, to ensure that we had vaccines for South LA so our community could be saved and Black and brown individuals could be prioritized. And that is how we operated that vaccine center, like it was a gate at LAX, where priority boarding went to those that lived in the neighborhood, those who needed it most, our grandmas who were most vulnerable, those who were driving our buses. Those were the folks that we took in first, and that's how it should be. The greatest needs, that is what health equity and racial and medical justice is all about, is where is the greatest need, and then how are we overcoming those disparities and inequities. That's what we did then, and now that's what we're trying to figure out how to do moving forward.
Dr. Jerry Abram is my guest. It sounds like it might be illegal in these times. We'll continue the conversation when we come forward on KBLA Talk 1580.
A safe place to go loud. A great place for progressive politics. KBLA Talk 1580.
One thank you. Yeah.
At KBLA Talk 1580, we're proud to be celebrating 4 years on the air, but we know we could not have made it this far without you. We work hard every single day to curate conversations that will enlighten, encourage, and empower you. So, from all of us at KBLA Talk 1580, a big thank you for your love and support.
You don't know how much you mean to me.
And by the way, if your smartphone did not update automatically, be sure to download our brand new KBLA 1580 app. We think you'll love all the new features, including new ways to send us photos and video in real time, whenever news breaks, while we're on the air. It's a new dawn, a new day for KBLA Talk 1580, and we're glad you're on this journey with us.
You never turned away, you were right there. Thank you.
We all hear the radio ads about the IRS. They tell you to be afraid, to be scared, and they try to frighten you into calling. I'm not here to do that. Tax Relief Advocates is different. TRA is here to tell you that if you owe money to the IRS, whether it's $5,000, $50,000, or $500,000, we have a solution. It doesn't matter if you're sitting in your car, at work, or with your kids. No matter where you are, call now.
800-550-9651.
Don't lose hope. TRA can eliminate or reduce what you owe to the IRS.
Generous programs are now available that can give you a fresh start.
Our passion is taxes and helping individuals fix their IRS problems.
We have over 1,000 5-star reviews on Google and an A+ with the Better Business Bureau.
You don't need to be afraid of the IRS any longer. End your tax nightmare today by visiting us online at TRA.com
or call 800-550-9651. That's 800-550-9651.
Tax Relief Advocates. Real solutions for real people.
An official message from Medicare.
I turned 65 this year. I knew it was time to figure out Medicare, and I had questions, like when to enroll and how to enroll. So I went straight to the official source, Medicare.gov, to get the facts about Medicare. I found answers to all my questions, and I'm ready to get started. And so can you. Just go to Medicare.gov to get the real facts about Medicare.
Paid for by the U.S. Department of Health and Human Services.
Are you having trouble hearing? Hearing loss can devastate the quality of your life. Now, there's an affordable fix for you or your loved one. Rated the best hearing aids of 2025 by Forbes Health, Audion Hearing has the highest quality hearing aids at the lowest prices, starting at just $98 a pair.
I actually like them better than my old $5,000 hearing aids.
I could not believe how my hearing and life changed.
Join over 1 million happy customers by going to audionhearing.com. That's AUDIEN hearing.com.
Thanks for waking up with Dominique DiPrima on KBLA Talk 1580.
Talking with Dr. Jerry Abram. He's president of the Los Angeles County Medical Association, trustee of the California Medical Association, vice chair of the American Medical Association Council on Constitution and Bylaws, and a member of the National Medical Association, National Hispanic Medical Association, serves on the board of directors for Charles Drew, the Historically Black County Medical Society, and numerous other boards, California Black Health Network, and on it goes. I say that partly in the context, Doctor, of looking at cuts to the CDC and the National Institute of Health. Thousands of people laid off, some of them brought back, then laid off again. It's very confusing. It's like not really sure where we are with any of this. Would all of these, any or all of these councils and associations that you belong to be a possible place for folks to turn for information as we start to see other sources dwindle or become unavailable?
Sure. Lots of ways to approach this question, and thank you for asking it, Dominique. I'll just start by saying, it's so funny that during the break, we literally heard from Medicare.gov about go and find out and sign up, but now Why would you trust? Who is there? I tell our community all the time, what good is that plastic card in your pocket if it doesn't get you anything? It's not just coverage that matters, but it's access to a clinic and a hospital and a doctor and the services and prevention that you need. So, yeah, of course we're worried. Like, what good is a Medicare insurance card if it doesn't get you anything that improves your health, helps you not only helps you when we're sick, but how does it help us stay healthy and well? And that is really the challenge that we have as a society ahead of us, is that we have built a healthcare delivery system that really focuses on sick care. But really what our community needs is wellness and a system designed to keep us healthy so that we never need those services in the emergency room and urgent care in the middle of the night. But here we are. And so you're right. It's a very tough place to be. I'll just say from many of the organizations that I work with, for example, the Los Angeles County Medical Association, there are over 30,000 practicing physicians in LA County trying to do the best they can to care for 10 million residents in this county, larger than most states in the union. We have a great challenge ahead of us. So it's not just about getting Medicare and our insurance plans right. We need to make sure that we are funding our hospitals and clinics adequately, that they're distributed appropriately to meet those needs, including those health equity gaps and medical justice gaps that we see in our communities, especially in places like South LA. We see those same disparities in Southeast LA, East LA, on Skid Row. Why are over 60 to 70% of the folks on Skid Row Black? If we are going to say that there's no racial justice problem here, we're fooling ourselves, lying to ourselves. And I'll also just mention, it's so important, there are many minority families, Black and brown families, because of cost, have moved to Palmdale and Lancaster, to the Antelope Valley. Where do they turn for care? So these are all real concerns that we have in our community. I'll say as we move along from the COVID-19 and the vaccine story, I hope that we can share a little bit of some of the innovation that is coming to trying to meet people where they are. And we learned a lot of those lessons during COVID, and that's what we're trying to do today.
Yeah, that's amazing and super important, because it does feel scary. It feels like things are being dismantled that we have relied on, maybe taken for granted. As a mom and just a human, I don't like hearing that we're seeing measles come back again. Don't like, hearing that, RFK has all kinds of wacky plans for what we should and should not be doing in terms of not just vaccination, but our health care in general. So I think what you've said, focusing on the innovations is a great idea. We just got 3 minutes here before news, traffic, and sports, but and we're also talking about reaching people that, like you said, unhoused folks that may not be able to just come in and get that care. So let's start on that. Let's go ahead and share some of the things that you guys are doing in that way.
Happy to hop in here. It was about December 2020 when those vaccines hit the ground. By March 2021, the lines really started to thin out. That's when we had the idea that we needed to take the show on the road. That's where my mobile vaccine program at KEDREN was born. And we started to go to where people live, work, worship, play, where they go to school. We made sure we did not forget about the homebound. We did not forget about the homeless. And so that's really where these ideas, where I call democratization and ubiquitization, how are we going to make it for everybody and make sure it is plentiful? And that really is the heart of the type of care that we deliver with our street medicine team. And that was an opportunity back then in 2021 to join forces. And that's when the Charles Drew University street medicine team, along with the KEDREN mobile vaccination team, came together to figure out how do we deliver healthcare in the streets, in the community, in these trusted and safe places. I call them priority places, where we take care of priority people and we take care of their priority problems, the PPP. And as a result, we're really able to improve health outcomes and offer olive branches and resources, services, and an invitation to come in ways that people have never been invited into those sterile four white walls of hospitals and clinics. And that's the reality. Here we are in 2025. There are plenty of people who are scared to death because they think that when they walk into a hospital or clinic, we're going to try to kill them, right? So we're really trying to overcome all of that.
But it sounds like also, and it's not fair to say this because we only have less than a minute, but it sounds like that model can be applied to any kind of health crisis or medication that's needed.
Yeah, I think, when we come back from the break, I definitely would love to talk about where can we go from here. And that's why these investments are so important. The work that Providence is doing, supporting street teams like ours so that we can deliver mental health care on the streets of LA and on Skid Row. We need more of that, but it takes investment and it takes all of us coming together as a community. And just like during COVID, you're on your own. We are going to have to figure out these things together by ourselves.
Yeah, well, I'm glad you're figuring them out. I mean, I feel like that's the part we don't hear enough about is some of the innovative work that's being done, and some people like yourself who are not afraid to say equity even in this moment. We're talking with Dr. Jerry Abraham and you on KBLA Talk 1580.
She's reclaiming her time on KBLA Talk 1580. More First Things First with Dominique DiPrima when we come forward.
I'm Bree Wood with BIN News Now. Cleanup is underway in parts of New Jersey and Westchester after flash floods damaged homes and stranded vehicles.
Got in there, got the cats, got the dogs, put them to higher ground.
I cry more for them than for my car.
2 women died in Plainfield where a house also exploded. Some areas saw up to 6 inches of rain and more flooding is possible today. A funeral was held for 26-year-old Taylor Walker, one of 4 people killed in a mass shooting outside a Chicago nightclub. Her mother has now lost 2 children to gun violence. 3 other victims were killed in the July 2nd shooting, and the club, Airdate, announced its closing permanently. And the City Council in Wichita, Kansas has suspended its diversity board to comply with federal rules and protect over $400 million in funding. The move follows a Trump administration order targeting DEI programs. Critics say it's a blow to civil rights efforts. Get BIN News Now on demand 24/7 on the iHeartRadio app.
Think It Up is an initiative to activate student-powered, teacher-led learning projects. Students and teachers, how can you spark great learning experiences in your classrooms today? Join at thinkitup.org.
Is this the time? This is the KBLA Sports Minute with Ray Richardson.
Kendrick Lamar and Beyonce have been nominated for Emmy Awards for their halftime performances at NFL games. Lamar has 4 nominations for his halftime performance at last season's Super Bowl in New Orleans. The Compton native was nominated for Outstanding Live Variety Special, Outstanding Directing for a Variety Special, Outstanding Music Directing, and Outstanding Choreography. Beyonce was also nominated for Outstanding Live Variety Special for her performance on Christmas Day during halftime of the Houston Texans-Baltimore Ravens game in Houston. Beyonce did her performance with the HBCU Texas Southern University Ocean of Soul Marching Band. The Emmy Awards show is September 14th, 5 p.m. Pacific Time on CBS. Major League Baseball honored Hank Aaron last night during the All-Star Game in Atlanta. Aaron passed Babe Ruth in 1974 to become, at that time, baseball's all-time home run leader. No debates, no speculation, just the info you need. That's your KBLA Sports Minute. I'm Ray Richardson on KBLA Talk 1580.
You have cancer. The 3 words no one wants to hear. Of the cancers that impact our community, lung cancer is the most dangerous. More people succumb to lung cancer than colon, breast, and prostate combined. Black men are 12% more likely to develop lung cancer, and cases for Black women are rising. Early detection and comprehensive treatment is the best way to beat this dreaded disease. Providence is a research leader in multi-cancer early detection, offering blood tests that identify fast-spreading cancers that don't show symptoms in early stages. The Providence Los Angeles Integrated Network Cancer Program determines best protocols for each patient, interacting with specialists who share experiences, perspectives, and new findings specific to each case. With over 1,000 board-certified physicians, including top oncologists, surgeons, radiologists, and nurse specialists, Providence delivers whole-person care that understands your culture, values, preferences, and priorities. So, if you hear the words, "you have cancer," all you need is faith and providence.org/cancer.
all I need is one mic.
With the KBLA Talk 1580 guest editorial, I'm Martin Gordon, chair of the Pasadena Community Coalition. Recently, I listened to a Tavis Smiley show conversation with James Farr. At one point, James said something that caught me off guard, not because it wasn't true, but because it is. Black Altadena is gone. I know it may seem stupid and non-productive, but I stopped in that moment listening to Tavis and James. I broke down and cried. In the back of my mind, I told myself we can bring it back like it was. But James Farr's reality check hit me like a ton of bricks. My community is being murdered. I said murdered, not by the Altadena Eaton Canyon fire, but by the people we elect to protect us, and by greedy and gatekeeping nonprofits who cannot see the forest for the trees. For the first time since the fire, I truly feel and understand my wife's inconsolable pain. Because I'm struggling to find a path to recovery and at least some form of normalcy. My community is crumbling right in front of my face. Lack of funding to rebuild is slowly destroying us. Many of us can no longer hold out, and developers are gobbling up our property. When I hear voices like Tavis Smiley and James Farr speak truth to power on KBLA Talk 1580, it reminds me that we're not crazy, just unheard. Make no mistake here, KBLA delegation, this is war, and we the people of Black Altadena are losing. It's like waiting for reparation. Not gonna happen, brother. In this new orange man world, no one, no entity is persuaded by right or wrong. There is no consequence for doing the wrong thing, and no accolades or support for doing the right thing. Will war-torn Black Altadena survive? Your guess is as good as mine. But what have I got to lose? I'm in my 70s and don't have time to wait. Dr. Martin Luther King Jr. once suggested that riots break out when people have no hope. But there's nothing left to burn down in Altadena. I wish I could say I remain hopeful that my beloved community will rise again like a phoenix from the ashes. I wish I could. With a KBLA Talk 1580 guest editorial, I'm Martin Gordon, chair of the Pasadena Community Coalition. Pasadena Community Coalition at gmail.com. Reach out to me. As always, we welcome your feedback.
This is KBLA Talk 1580, where hate loses and love wins.
Talking with Dr. Jerry Abraham. He's the president of the LA County Medical Association, chief vaccinologist at CDU-KEDREN Mobile Street Medicine. And Dr. Abraham, before news, traffic, and sports, we're talking, you mentioned how many black folks are among the unhoused on Skid Row. You were also talking about the mobile mental health services and these innovative models to reach people where they are, in the sponsorship of Providence in this. I have a question I've asked a couple psychologists and psychiatrists. I'll pose it to you, and maybe you can answer it in the frame of what you're talking about, of reaching people where they are with mental health care. I feel like I have never seen so many people, particularly black people, in severe mental health crisis, either on the streets or, off the streets. I note that the suicide numbers are up among black children, black boys in particular. I note that you can just see it. People in severe crisis walking around. What do you attribute that to? Or is it just perception? I mean, I feel like maybe there's been a collective snapping.
So here's what I would start by saying. I really appreciated listening to the break, to be honest, and looking and listening about how do we achieve Black health equity when it comes to even cancer detection, screening, treatment, right? So this lens and this project is just one of them. In partnership with Providence, their foundation, Wellbeing Trust, we've really been able to look at innovative models so that we can deliver the care that we deliver inside the hospital and the clinic. How can we deliver that from a van, a mobile unit, from a backpack walking the streets of Skid Row including things like delivering very important medications that people living with very serious mental illnesses need. If you're living with really uncontrolled schizophrenia, bipolar disorder, severe depression with psychotic features, and you are just chronically suicidal, these folks need very serious medications that help them be able to control their thoughts, calm their minds, really take control, stop the voices, stop the things they're seeing. All of that is happening. Why is it happening? Much more complicated. Are there genetic components? Sure. Are there absolutely environmental pieces to the puzzle? Yes, and there's no doubt that the trauma that our generations and our present selves have gone through are getting coded into our DNA. They're being passed down. So I have no doubt that all of this has contributed to why we see what we see on the streets here, particularly with Black patients who are living with serious mental illness and serious substance use and alcohol abuse issues. And so what can we and should we do about it? And I think one thing is, let's just first and foremost, as our team does, we have several mantras, and one of them is not only meet people where they are, but really respect the dignity and worth and humanity of every individual we come across, including the members of our team. We go out of our way to include people on our team who are from our communities, who are Black and brown, who have lived experiences. When those folks are able to connect with their peers, their community members, their brothers and sisters on the street, that really does shift someone's mindset. Somebody actually cares about me. Maybe I should take Dr. Abraham or the psychiatrist or the psychologist's recommendations more seriously, either to get medicated, to get the help I need, maybe to take that shelter bed or to get off the streets. Those are very important conversations, but they need trust. It really requires us meeting that individual where they are. And even when we do that, we just know we're dealing with a lot of challenges. And what the conversation I may have with you may not be the same way that I can have it with someone who is acutely psychotic or someone who is high on meth. And so we do have to kind of grapple with, those are the realities. That's the kind of innovation. I call it the test kitchen, the laboratory that we are building here on the streets of LA, is trying to figure out how do we solve those issues. And that's why it's important, the work that Mayor Karen Bass has been doing to really figure out this homelessness crisis. Not only do we have a housing shortage that's contributed to it, but clearly the lack of mental health resources, the lack of resources for substance use and addiction, the medical racism that has resulted in Black people being disproportionately harmed and ending up on our streets. All those have to be tackled. They require investment. And in this era, those are complicated conversations, complicated budget conversations. And we know the city, the county, the state, and the federal government, we're struggling to find those financial resources. But with foundation support like the one that we had, we were able and are able to figure out how can we do things a little differently. Will that help Mrs. Jones not only stay off the streets, but maybe stay out of the psych hospital and try to kind of put one foot in front of the other? Imagine a day that Mrs. Jones can actually pay her rent, figure out how to prepare her own food, take care of herself, bathe herself, clothe herself, and live a meaningful life. That's what we hope to accomplish by taking the care out to the streets and the people.
Yeah, it seems like it seems like a great model, just given. I always talk about the schools, our public schools. The model that of the past was send it home with the parent, or make sure that the child's parent oversees this process. And when you have a system that contains so many foster children and so many unhoused children, then that means our business model is not meeting the customer as they present today. And it sounds like that's a similar thought process that's going into this mobile medical initiative.
Yeah, absolutely. And, something we haven't had a chance to really talk about is that as the resources at the federal level are changing, and as they demonize those of us working in health equity and racial and medical justice in Black health and Latino health, we are now becoming the experts. So during COVID-19, I had kind of hinted at this during interviews and, speaking in the community, silver linings, and in this case, I think one of the silver linings is we take back the narrative, we take back the care, we own it, and we do it differently, and we do it for ourselves. And so this may be a chance for us to build a system ground up that actually meets our needs and that we were a part of its formation, its creation. It's of us. It's for us. I have a feeling then it's going to deliver a care that is much more meaningful and impactful to our health. And so that's one major priority is how do we, the Charles Drew Universities of the world, the KEDRENs of the world, the MLK hospitals of the world, the KBLAs become the experts, the champions of advancing Black health equity and making sure that that work does not slow down or stop because we don't see the guidance or the leadership from Washington. And that, I think, may be a silver lining that comes out of all of this. I'll also say there are so many amazing leaders we need to call upon. Look at how many Black women and men are serving as physicians, not only here in LA, but across the country. We have many people that we can look up to. This past week, I had the opportunity to have a discussion with Dr. Uche Blackstone, who wrote the book Legacy, about her experience going to Harvard Medical School as a Black woman, being the child of a Black woman doctor, and what those struggles look like. And now, how have we kind of turned back the dial where there are less Black men training to become physicians than in previous eras? Why does it feel like we're turning back the clock on a lot of the gains that we've made? So I think that's where the pressure needs to be on. We need to be the standard bearers. We need to make sure that our message, our cause continues to move forward despite what's happening around us. The last thing I'll say is as we do that, for me, that means focusing on priority people, and that includes those folks experiencing homelessness. That includes those with serious mental illness, substance use, those that are justice involved, coming in and out of probation, parole, prison. It includes those that are living with HIV, Black mothers who are not getting good prenatal care, older Black folks that are not getting appropriate dementia care. So when we really talk about achieving Black health equity, there are very specific things that we can do. That's the type of work that my team's doing. That's the type of work that many people across this wonderful county are trying to tackle these challenges with innovative solutions like some of the ones we talked about today.
I mean, and to be clear, diversity, equity, inclusion, DEI, or so-called wokeness, i.e. talking about things like equity, health equity, it's not actually illegal. It's just being targeted and discouraged right now. You don't seem to be deterred by that at all, Dr. Abram.
We have to be glass half full. We have to be the optimists. We have to think of our forefathers and our ancestors and all that people have traveled through, this journey, this arc, this march towards justice. So we cannot be deterred, distracted, discouraged. We must have hope. And I literally woke up this morning and I prayed, God, give us the strength we can take whatever the next attack on our community is. That is how I prayed every morning during COVID-19. That is how I'm praying today. We can't let them let us and let ourselves down. And so it needs to be this clarion call that even more so we must step up. And to your point, that's why I think now more than ever, okay, they're not going to help us and tell us what to do. You're right, we didn't, because we're the experts anyway. We are the experts in Black health equity, and we are the experts in how we address the injustices when it comes to medical racism and how we get to where we need to go. So then let's step up, and that's why it's so important that we start training the next generation. We start teaching the community these things. That is where I do see some of these silver linings. Like, I never thought, and I think it's important, even our team members, they don't look at themselves like experts. I want them to now. They absolutely have a knowledge, a skill set that needs to be shared. They have a very powerful tool and talent that is so valuable. That's the empowerment that our communities need right now. And when the world sees us as the experts in achieving that, I think also will achieve the respect, but also the resources, the financial backing to continue to advance this work for our communities.
We're talking with Dr. Jerry Abram and you on KBLA Talk 1580.
More First Things First with Dominique DiPrima when we come forward. forward.
Hello, family. This is Dr. Rosa Milligan, self-appointed mayor of South Central LA. I'm sounding the alarm. AI, artificial intelligence, is not coming. It's already here. Join me with a powerful Zoom seminar that will teach you how to use AI for your personal and business use. Go to mytechacademy.net or call 213-878-4742.
Let's be real. Too many black businesses missed out on COVID PPP loans because they weren't tech ready. We can't afford to be left behind again. This time, we must lead. Register today at mytechacademy.net or call 213-878-4742.
You know me, Dr. Rosa, trusted voice of the people, 50 years fighting for literacy, technology, and living trust education. And now, I got your back on AI. Go to mytechacademy.net or call 213-878-4742. Your future is calling. Answer.
KBLA Talk 1580. We've got a lot to talk about.
KBLA Talk 1580, connecting you with services and solutions. If you need help getting your resume in order, finding job training, or landing a job, we've got 3 great options for you. First, the City of Los Angeles has WorkSource centers across the area offering free job support. The California Workforce Development Board can help you with everything from GED prep to vocational training at no cost to you. On the federal level, the Department of Labor's American Job Centers offer a full range of services for job seekers and businesses alike. Visit careeronestop.org, or for more info, just call California's Help Center or visit cwdb.ca.gov or call 916-657-1440. For the City of Los Angeles programs, go to ewdd.lacity.gov or call 213-744-7300. All these services are free to help you get your next job. This is a community call to action from KBLA Talk 1580.
The conversation continues right now with Dominique DiPrima on First Things First.
Talking with Dr. Jerry Abram, the president of the LA County Medical Association, director-in-chief vaccinologist at CDU-KEDREN Mobile Street Medicine, and much, 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 much more. If you were us, if you were not a doctor right now, would you be running out and getting a measles vaccination? Would you be worried about this resurgence of that we're reading about of preventable diseases?
Yeah, here's what I'd say. I know we don't have a lot of time left, so I think the take-home messages from today's conversation, I hope we continue these conversations well into the future. I think while we are under attack, it is so incumbent upon ourselves, each other, our families, and our community to really make sure that we prioritize taking ourselves now more than ever. Are we eating right? Are we exercising? Are we sleeping right? Are we being mindful or meditating or building and being in community, whatever that looks like, whether that's a faith community, whether that's with your neighbors or your family members? Are we doing all those things? But it also includes making sure that we are fully up to date with all of our immunizations. It means that we're definitely taking serious our annual doctor's checkup and making sure that we're getting screened for all the things we need to be screened for: diabetes, blood pressure, cholesterol. Are we making sure that we're being screened for colon cancer, breast cancer, cervical cancer? You name it, based off of your age, your demographics, your gender, sex. There are very important things we should be checking off our to-do list to make sure we stay safe, healthy, and live our best, highest quality life as long as God intends for us to be here. So that right now, I think, while there is so much distraction and noise, hold on, let's take a moment, let us breathe, let's get back to the basics. Are we doing those things? Because if we're not well, if we're not healthy, we're not going to be able to help our communities and get better.
Yeah, and I love that you call it a silver lining. The silver lining is we may be, even if it's be forced to, but we may be empowered to take matters into our own hands in terms of educating ourselves and preventative care and our regular maintenance of our health and well-being, as opposed to being fearful. I think about fear itself as a mental health pressure. I think about I really feel for LGBTQ plus young people right now because of the way this administration is moving with trans folks, with just LGBTQ plus rights and such. And I think about the epidemic of fear and how it presses on our mental health. How do we take that? What's the preventative medicine for that stuff?
Sure. I remember during COVID-19 how important it was. Very early on, we knew that we would have to partner with Black churches and Black organizations in order to get the job done, to get our community the resources, the vaccines that they needed. And it was those trusted messengers, whether it was auntie or grandma or our pastor or our teacher. These were the trusted leaders during those times. So right now, we definitely need to come together. We need to step up. If we're not that person, think about being that person. Think about being the person that someone can look up to, ideally a young person behind you. Let's not shut the door on people. Let's make sure we're trying our very best to try to hold it open and bring as many people, just like I mentioned about Noah, on board, get on board. And that's okay if they look a little different. That's okay if it's a Black trans woman, right? Let's make sure we take care of each other. They are losing their health care right now. You can do something about it. You can make sure they feel welcome and that they are seen. Those are things that we can do. It's that kill them with kindness that I think is going to overcome the destruction that we're seeing all around us right now. So this is something I talk about with my teams. This is something we talk about every day on the streets. Is we cannot let this fear get to us. Somehow, as hard as it is, they don't want us to be happy. They don't want to see that we have joy in our lives and that we are well. The best way to combat this is to make sure that we are prioritizing those things and that we're genuinely feeling those things. We do have one life, and I believe we're supposed to live our best one. So do that, and do that actively right now in this moment. Do that today. Do that this year, and do it this whole administration. We will be stronger and better for it.
Yeah, I love that kindness as a mental health, tactic for ourselves and towards other people, because I feel like I'm not a psychiatrist or a psychologist, but I'm talking friends and family off the ledge every single day, and I think that that actually helps me feel better too.
I think action really can combat the paralysis. So just do what you can in this moment to make the world a better place, to bring a smile to someone, to bring laughter and joy. I really do think about this, whether it was during the slave trade, whether it was during the Holocaust in Germany. People still needed to laugh and dance and find joy and to be in relationship and to be in communion and fellowship with one another. These are dark times, but we have been there before, and we have laughed and danced and smiled our way through it and survived. That is the take-home message today, and please don't let anybody rob your spirit of that.
I love that. I have this theory, Dr. Abraham, that the colleges should all be doing proms, high school proms, for all the kids who, as my son said to me, COVID robbed me of my high school experience. And I just feel like, I'm not a shrink, but I feel like we have done a lot of lip service, but not enough actual follow-up to get past the trauma of 2020. And here we are in the trauma of 2025.
Yeah, exactly. And I was just at a health equity meeting last week, and we literally were joking about that. How fun would that be to have a Black health equity prom, where we can just be our best selves in ways that maybe we didn't get a chance to do in high school or college, or all the different missed moments people have had in their lives. Imagine being able to recreate that for folks today. How empowering that would be.
Proms for everybody. So Dr. Abram, you want to tell us how to follow your work or the work of the mobile street medicine units?
Sure. What I'll say again, KEDREN has been a pillar in our community. It's a historically Black institution, Acute Psychiatric Hospital, and federally qualified health center right here at 42nd and Avalon. And we're building a children's village now so we can help our young folks with their mental health crises, including acute psychiatric hospitalizations down in the Watts area. We also are very closely tied with Charles Drew University, our academic partner, where we are training the next generation, particularly Black and Latino medical students, doctors, and all sorts of other health professionals. So it's very important. Look to Charles Drew if you're interested in joining the ranks and becoming a health worker, health professional, but look at places like KEDREN, the clinics, the hospitals, the pillars in our community that are there to help you and your family members. If you want to help, come volunteer, be a part of the joy, the movement that's making our communities better. Seek help. Don't wait. Don't delay. When you need help, when you need health care, please go get it. And if you're scared, let's find someone to go with you, whether it's a family member, a trusted friend, someone from church or school or our community. But we want to make sure that you're not afraid of us, and we're going to keep doing the very best we can to come to you. So come learn more about us at www.kedren.org. You can also learn more about Charles Drew University at www.cdru.edu. And lastly, I'll just say our ability to do this work, we definitely are thankful, and we are grateful for all the resources that are given to us, including from Providence's Foundation, the Wellbeing Trust that allows our teams to roll out on the streets right here in LA.
Dr. Jerry Abram, thank you. Tavis Smiley's up next. He's got a full show on deck for you today. Like my mama, the great Diane DiPrima, used to say, history is now. Like I always say, we're making it together. Until next time, one love.
KBLA 1580 Santa Monica.
I'm Bree Wood with BIN News Now. Cleanup is underway in parts of New Jersey and Westchester after flash floods damaged homes and stranded vehicles.
Got in there, got the cats, got the dogs, put them to higher ground.
I cry more for them than for my car.
2 women died in Plainfield where a house also exploded. Some areas saw up to 6 inches of rain and more flooding is possible today. A funeral was held for 26-year-old Taylor Walker, one of 4 people killed in a mass shooting outside a Chicago nightclub. Her mother has now lost 2 children to gun violence. 3 other victims were killed in the July 2nd shooting, and the club, Artiz, announced its closing permanently. And the City Council in Wichita, Kansas has suspended its diversity board to comply with federal rules and protect over $400 million in funding. The move follows a Trump administration order targeting DEI programs. Critics say it's a blow to civil rights efforts. Get BIN News Now on demand 24/7 on the iHeartRadio app.
Think It Up is an initiative to activate student-powered, teacher-led learning projects.
NFL games. Lamar has 4 nominations for his halftime performance at last season's Super Bowl in New Orleans. The Compton native was nominated for